So here's what I want to do. First of all, give them another round of applause. Amazing, amazing. I don't want to start with the first question because you all have been waiting for some time. So I want to give you the opportunity to ask a question. Then I have questions prepared for them. Are there any questions coming from the room? Yes. Yes, sir.
So it would be good if people identify themselves and make friends here.
Please stand up, identify yourself.
Okay, Dave Gutman. Have really no credentials, but I was interested in the walking portion, and given the rise of the shared ride economy, along with probably autonomous cars and battery-powered cars, I see within 10 years most people not owning cars and starting to move towards doing the shared ride thing. That's going to make it so you'll have the car right outside your door and not the same public transportation where you'd have to walk a half mile to the subway or whatever mass transit. I'd like to hear your thoughts on that and how that's going to affect the.
Thank you.
Okay.
Going to have you take that one, Larry. Planner on stage.
Okay. Thank you for your question. My students, this is what they are most interested in, and I just finished yesterday giving my last lecture of the year on transportation planning, and this is what they chose to work on for their final project, is really emerging technology and how it's reshaping our country. We think about it all the time. Vancouver actually doesn't allow Uber and Lyft in Vancouver. We're a highly regulated landscape when it comes to things like that, not some other things. I mean, it's really a little bit uncertain how that's going to sort out. I imagine it'll sort out demographically, but there's definitely a fact that, and we saw it in the study I showed you of Comox, that corridor, with car sharing. I mean, in fact, car sharing made driving easier. So your point taken, we observed it already. So we're concerned, will autonomous vehicles, or AVs, reduce physical activity? Will it make our cities less walkable? Will it encourage sprawl? I think the research is sort of unclear. Circumspect, or I think, hypothesize that we're going to get more sprawl as a result, but our cities themselves might actually become, in some ways, more walkable in the core. Maybe that plays into the patterns we see for how people socialize, and that might affect actually voting, possibly. Interesting, not been looked at all. That's a new linkage. I haven't thought about it.
Thanks, Larry. Going to take a question from the center. We'll go over here. Yes, sir.
Always get good physical activity for the person who carries the microphone around.
Right.
Hey, Jasneet.
So I'm Raymond Neutra. That map of red with little blue dots on it illustrated something that I've been pondering about now. And that is the cultural difference, both ideologically and by interest. It would be interesting to know those red states, many of them are going to get very hot, they'll have dengue, but most of them won't be flooded, right? I'm trying to understand the culture and worldview of the people in the red areas. And as you describe all the benefits of the new urbanism, there's no place for fundamentalist religion, which is so important to some of those people. There's no place for the hunting and gun culture that is so important for those people. And we talk to them as utilitarians, as cost-benefit, and it'll balance out. The one set of stakeholders ought to be cutting down on their profits so that another set of stakeholders will save money. But it all, as Jeremy Bentham told us, evens out. But those people don't operate. They operate with strong duty ethic. So we need to have fundamentalist ministers involved in this discussion. And we need to map on that way of looking at things and figure out how that particular set of spectacles could get motivated to respond to reality, really.
Right. Is that a question, or you just wanted to?
Well, I'd be interested in the public health people. How do we involve those other stakeholders that have such a different, the leaders of the other stakeholders that have other values?
Got it.
Ray, thank you. Boy, we could have a long, long conversation. I hope we will one day. But I want to quote Arlie Hochschild. Arlie has written a wonderful book called Strangers in Their Own Land, which is the results of her having embedded herself for several years with Tea Party people in the Deep South to try to understand the thinking there. And she comes up with a metaphor, which is you're standing on a long line that stretches up to the top of a distant hill. And at the top of the hill is the American dream. It's a measure of financial security. It's a better life for your children than you had. It's freedom. The line's moving very slowly. That you're okay with that because it moves slowly for your parents and your grandparents too. And I should mention you're white. That's who she's writing about. Then you realize that the line's not moving at all. And then you look up ahead in the line and you see that people are cutting into line. And then you see that they're people of color. They're different than you are. They're not in your tribe. And then you see that your government is helping them cut in line. And you feel outrage and betrayal. And you join the Tea Party and you vote for Trump. I'm oversimplifying her book. But I mention this because I think the most salient thing about those large red expanses isn't loving guns or hating abortion. I think it's being left behind by the economy. And so Piketty has written about this inexorable drive in capitalist structure toward more capital accumulating in fewer hands and more people being left behind. This is an issue that is right at the heart of public health. It's an issue of social justice and equality. And what happens is, as those differences deepen, it gives an opening for demagogues to whip up tribal hatred. We're seeing this not just in the US, but around the world. And that undermines the efforts that we all make to improve health and well-being in an equitable way. So sorry for the long oration here, but I think that at the heart of the values differences you pointed to and the demographic differences between cities and the countryside is a set of economic trends, inequality, and unfairness that people respond to. And we need to be attacking those head on in order to get to some of the more derivative problems that we've been talking about today.
I want to challenge you on that a bit. The reason why is because I don't want to equate or conflate class issues with race issues. There is a gray area there, which is one that is often not talked about enough in public health, which is racism, white supremacy. You can easily look at that red and say that the ideology of the red is probably that of racism, white supremacy. You can also take your last couple slides, the one where you started with Trump being, President Donald Trump being sort of the impetus for this all and the voting to elect him. But there's a history before that, one that was racist also. So how are we in our fight for increased public health, decreases in health disparities, fighting the energy that birthed Trump?
Boy. Well, how are we fighting the energy that birthed Trump is a big question. Can I just focus on the piece of it that's
Well,
racism?
the reason I bring it up because I don't want us to walk away today with this first slide or the image of Trump being sort of the discussion we have about racism, white supremacy in the context of public health, or the voting, making it appear as if it started there. We have a 400, 500-year history here of it being present. We can look at residential racial segregation in this country where many whites have chosen and continue to choose to live separately from other cultural groups. So I want to talk about that and the impact it's having on the public health outcomes of minorities.
Yeah, so thanks. As a starting point, I have to agree with you 100% that racism is a separate, nefarious force, separate from class issues. But they have something to do with each other. And the more majority tribe members feel pushed, the more they are vulnerable to their own racism. The more collective we can be, the less tribal people can be, I think. So I think that the two sets of trends play off each other. I think racists get worse when they're poor and feel desperate. And I think poor people get more racist when they feel desperate and they feel like they're competing with members of another group. And I really agree with you that we need to address both, call them out, name them, and tackle both problems alongside each other.
Right. Thank you. Let's have a question.
Boy, all the hands
we got
are
a lot of hands,
yeah.
right? That's the energy we need. Chris, yes.
Chris Katitsky, and today representing only myself.
This is the nature of the federal government, by the way.
Yes, I learned that, yes. So I sort of want to follow on this discussion because I, as a community designer, I believe in the transformative power of changing the environment, whether it's the natural environment or the built environment. The question I have is, if you look at some of the research, like one that I think Dick mentioned at UIC, where they put green space into urban housing projects and the domestic violence and child maltreatment went down statistically just based on having green space in these in this housing complex that wasn't there before. How do we scale that up? And so the question is from what you all three have observed, do we need to reach out to politicians? Do we need to reach out to professionals, be they health professionals or community design professionals, or do we need to reach out to people? Where does the most effective, most rapid change happen in one of those three areas, or a fourth area that I haven't even thought of?
All right, Dick, you want to take that one?
I'm sort of slightly daydreaming here because I think we're in such an amazingly creative, rapidly changing time. If 2 years ago you said to me that we would have an administration that would repudiate a man who was brilliant, who had a classy family, who spoke in ways that you have to be filled with admiration, who tried to get everyone health insurance, who sang at the funeral in Charleston. And for him to be demonized in such a way at this point, and the effort to roll back all that he accomplished. And I think we're in such a creative mode. Anyone that pretends they know how to deal with this that we're in, I think we're in dangerous zones. Our students, and I say this to the students in the room, we've got no easy answers. All we know is we're going to have to dive in and work very hard at the local level to connect. And I'm seeing more and more of our young people. My son was saying that his division director at CDC resigned from CDC to move back to Washington State to run for elected office. And we're seeing this over and over again where people are saying, I cannot sit back. Democracy will not take care of itself. Everyone's going to have to step up. And what this is going to look like 3 years from now, I don't think anybody really knows. But I think demanding that we have an effective, smart, muscular voice, power towards the issues that we think are important, related to racism, where we live, walking, health, you name it. The era for sitting back and figuring it's going to be fine is over. I literally remember being in class before the election. I said, boy, oh boy, California's had a great, LA has had a great, wonderful, in my opinion, a wonderful president, a terrific governor. He has his mistakes, but he's done a great job, and a superb mayor. That's a trifecta you don't get very often. And it's not going to happen again unless we really work hard.
I was really touched by all three presentations. Dr. Frumkin, your presentation is sticking with me because it was the most recent one. And it was great.
And you're sitting closest to
And I'm sitting closest to you.
gravity model.
One of the things, though, that you and Larry touched on and Dr. Jackson has talked about also, you mentioned climate migration. Larry, you brought up gentrification and displacement. I was reading an article recently that talked about blacks are moving south, and they're moving back to places where their ancestors once ruled in a way. Atlanta, Charlotte, Washington, D.C. So is it climate migration the reason they're moving, or is it simply because they can't afford to live in the New York, the New Jerseys, and other places across the country? Which one you think has more pull at this point to cause that shift? And Larry, you can jump in on that as well, knowing that there's a lot of gentrification taking place in those cities.
Yeah, my sense is it's much more economic and social than it is climate-driven.
Well, the reason why I asked from that perspective is I think we need to disaggregate the data when we talk about it. We present the numbers, but we don't talk about the people. And as a person that represents an ethnic minority, I think it's important for me to hear how that minority is suffering, given the presentations that you guys are giving. So that's why, you know, in talking about gentrification, go ahead, Larry, I hear you nodding. You can go ahead.
Yeah, the scale I was talking to was really intra-regional, not inter-regional. Howie has more knowledge, I think, and understands on the inter-regional. But the issue, and I guess the research question is the cost of retention less than the cost of displacement? Or can we prove that the hypothesis is that it is cheaper to provide affordable housing and maintain mixed income communities when you invest in infrastructure and increase land value, you displace. And we're seeing that the demand is there, and the people that need to be there the most, elderly and people that are most disadvantaged, need to be near transit to get around even more than those that have another choice. So if the displacement, and we can measure healthcare costs by location. We have the data to do it. We've started doing that. We have a pretty good idea of a surface of healthcare cost utilization, and you can break it apart by prescription drugs, inpatient, outpatient, and all. And we've been working with different data sets in both countries doing this. So I think attaching a cost surface of healthcare with housing and transportation, all three, we can start to measure and very, I don't know how accurate, we can put at least some evidence to the cost of displacement, but we need to know the migration is where are people really going, so, and that is fine, so it is measurable, and that might help make the case for retention versus displacement.
Yeah, so I guess a more direct question, and I'll go to the audience, is how do you feel about gentrification? Has a negative connotation associated with it. But there are those, and I don't know how you all personally feel about it, that there are many benefits to the gentrification of a community. I want to discuss now the pros and cons of that. So I'll start with Dr. Jackson because we've had a brief discussion about it, but in the context of building healthy communities, what role does gentrification have in that process?
Throughout history, people that have the money will move to the least polluted side of Los Angeles. We all know that for a fact. The housing values will become more valuable. Over and over again, money will dictate. They're the first ones to have the color TVs, the air conditioning, the sprinklers in the home, and again, but what's happened with the extreme disparities of wealth that we're creating now, and this is, I was listening to a story about this building 9-something Park Avenue that's 100 stories high, and the top penthouse is $100 million, and the people that own it are only there about a month a year, and over again, we're creating basically these strong boxes of money in the sky. They're really not communities, they're money. And the people that work in these buildings, in the very highly developed, rich places, all live way out, for example, in the boroughs. They're commuting an hour and a half, 2 hours to get to jobs. One of the buildings that was built after Superstorm Sandy in New York it was along the East River, and It had two entrances. The one side of the building was all very expensive, and people with money could come in, but they were forced to have affordable housing. So they built a separate entrance for the affordable housing on the back side of the building with no views, because money will always figure out how to do. But I think the underlying on this is the extreme disparities of wealth they were looking for. Working with ULI, I remember I talked about the fellow that said, don't build around golf courses. We were in this discussion, and I said, hey, you know, what are the kind of people you want? He says, I know the people I don't want. I don't want people that are there only a month a year and are coming in and out. I want people that are there for the community. You know, I'm going to just, and maybe you're thinking I'm crazy, that in the book, the PBS series, back up, I think Los Angeles is a totally fascinating place. And I love being able to go to Japantown and having dinner, and little Bangladesh and little Armenia town, and people want to be with people that they feel comfortable with, and it's not going to go away. But I get on the bus. I lived here for 6 years without a car, and you have people from all different kinds of culture, and in general, people were getting along perfectly well. So there is a kind of respect that urbanites have to learn to get along with people, because you cannot survive in a city if you can't get along with people, at least not very long. So I think maybe the urbanization, by the way, urbanization is the best counter to overpopulation. People move to cities, they don't have enormous families anymore. And it pushes education and other things. It's a work in progress. But I do want our poor neighborhoods to have their trash picked up, to be better policed, to have better parks, to have better schools, and better public services, and better buildings. So why can't we have it all? We're rolling in money that's going to strong boxes in the sky.
I'll go to the audience. More hands are up. Starting here up front. Yes. Given the time limit, please be very quick with your question.
Where's the clock?
Bruce from Los Angeles County Public Health, but like Chris, I'm representing myself today. So I really liked the slides about the global South. I thought that was fascinating. We have our own cities in Los Angeles County that have basically the same kinds of conditions that you're describing elsewhere in the world. They're going to be the cities in LA County that are going to bear the brunt of climate change, that already are bearing the brunt of lack of parks, lack of green space, lack of bicycle infrastructure, pedestrian-friendly neighborhoods, all of this kind of thing. So my question is this. We have lots of discussions in the abstract about equity, about race, and about class. How do we have the courageous conversations that it's going to take to talk about how we're going to invest equitably in these cities? Because I think that's at the root of really what we need to do in the regional conversation we need to have.
Great.
You want to take have an answer too?
Well, one way is you could check out with America Walks, my new webinar series called Walking Towards Justice, where we have that exact conversation. It's very candid, it's very raw, you say what you think, no one is judging anyone, and we tackle these very, very tough and sometimes challenging conversations around race, gender, and class issues. So that's one place for you, Walking Towards Justice.
Yeah, it's a complicated question, Gene. Again, it's a long discussion. I guess the one thing I'd say is that every time we have a conversation about improving a neighborhood, whether it's more green space or better schools or better policing or better streets, we need to weld that to a conversation about social policy that will avoid or minimize the displacement of people. You can't do infrastructure or streets or any other kind of improvement if it's liable to raise values and push people out from where they live. So now the social policies are really complicated. You can force housing values to stay at a certain point, or you can give people entitlements to stay where they are, and time tends to erode those things. It's very complicated to get it right, but we certainly aren't going to get it right if we ever let ourselves talk about improving neighborhoods without talking about the social justice that has to be a part of that.
I'd like to add to that. It was in Seattle, and I mentioned to Howie yesterday that the resiliency officer, I think Bloomberg funded, was there, and we talked about walkability, and they very quickly said as soon as we make a neighborhood better, or start to, they can't even go into a neighborhood anymore without the sensitivity. The antennas are up, right? Everybody knows, oh, you're going to do these improvements. I won't be able to live here. So that we have to marry the conversation around equity with improvement. It can't be separate anymore. In fact, in Vancouver, the study I showed on Comox, we're doing a separate study now, a new one, and the regional agencies are funding it. And they said, housing is so unaffordable in Vancouver. The slope, the affordability is so bad. People have to drive so far to get to where they can afford to even rent. The displacement, we're losing culture, artists, the richness, everything is going away, eroding from offshore money so much. So I think that's really the next step, is that no longer we can't do any discussion around improvement without literally fusing together the discussion around how you're going to handle social displacement.
I'm going to just jump to two of Howie's slides at the very end, which is it's always about money. And, HUD, for it to be going through a constriction where they're doing less and less of supporting this kind of housing underneath a neurosurgeon, African-American neurosurgeons, beyond my understanding. But these are such important issues, and you can't do it without real money. It comes back to the politics.
Moving over here.
Mike Chair at UCLA. So I want to just change the topic to smart cities and technology and the role that has to play in making a more sustainable community. And all over the world, I was in Copenhagen last summer, they have something called the Green Wave. So they actually embedded sensors in the road so that when there are enough bicycles, the light changes for the bicycles and cuts all the cars off. There are examples like that all over the world, and my main question is, why aren't they happening in America and to a lesser extent Canada? Because they're really not. I mean, we're still in a 1950s traffic engineering mentality that at this time of the day the light turns green and it lasts for 3 minutes and it doesn't matter how many cars are there. And we're really not adopting these technologies, and they're available. So what are the barriers to doing that, and why are we not seeing our cities become smarter faster?
Yeah, and to Mike's point, I was in Wakanda recently, and they had all these technologies, so help us out.
Wow. Well, we all have answers to these. I hope everybody will chime in. I'll start off and say a few comments. Obviously, we have to popularize the case studies, the wins. So and overcome the notion as a society that it's not transferable, that what's done in one country is not transferable to another. Clearly, that would work. Well, you actually are on our walking tour yesterday. They took us on an incredible walking tour. There is a sensor we're starting to calculate and measure that here a little bit. So the data is coming, but obviously we don't have the how to build the political infrastructure. Is investing in the next generation of decision makers, grooming and funding and paying for training, a new round of political leaders that see this as the future. But the wins are there, and the way obviously, if we can put some economics behind it on what the cost savings are, that seems to be a little bit of a shorter pathway. So monetizing, that's why we focused on the monetization piece, but that's not going to do it because there's no money. You're in public health. I'm not that answer. I'm in public health too, but I came in from the back. But the issue is really that if we have, even in a socialized healthcare system in Canada, if we can't prove it there, that's, you think we would be. So we're going to have to really work hard on not just the elected officials, but how to use the monetization results is where I guess we have to go figure out how to use those economic payoffs and show they win. Because the healthcare providers know that the money's all spent on the last year of life. So that's what I'm told. Patty Daly is the head of Vancouver Coastal Health Authority. She says she was the biggest champion we had for our rail system vote that went down. And she said, we get it. Prevention, built environment, transit. Dick made the point very clearly. This is all preventive medicine. Who's got money for preventive medicine? How do we find some?
So we have only 5 minutes left. So what we're going to do now is move into like a rapid fire round. Ask your question quickly. We'll answer it quickly. Question from the back.
I'm Shane Cuhey from Department of Environmental Health Sciences. want to ask the panel, the disparity between the quality of living of people in Europe and Canada versus United States is quite striking. One of the things that's very, very different is that those communities have a greater say in their governments, and our communities essentially are both the political parties, the two major political parties, are both controlled by the 1%. So, and it's essentially known that if the communities have more say, then all the minorities will also get more of the pie. So that implies that proportional representation as a voting system ought to be the voting system for the United States. Do the panel members foresee that, and how could that be implemented in the United States?
Thank you.
To take away power from the 1%.
Thank you. Anyone want to, or you want to talk to him afterwards?
Great question, but boy, none of us is an urban political scientist, so I'm guessing that on behalf of all of us.
Your work, both of you.
We're gonna address that question during the break. Over here, yes, quickly.
My question is really about going back to the definition of designing a healthy community, whether any of those metrics are specific to, rather than being more general, if any of them include metrics that are specific to health of children and families.
Yeah, I mean, a lot of the outcome measures that I know Larry's used, we've all used, focus specifically on kids. So you can look at the proportion of kids who walk or bike to school, or you can look at park use specific to kids and so on. So I think a lot of the metrics people are using in studies now either are or can readily be tailored to particular age groups.
And I think Dr. Jarrett did one of the studies, excuse me.
No, go ahead.
No, Mike knows a lot about this, actually, about how you can look at children changes as well. Excuse me.
Well, I'll just mention that the health interview survey data here is big enough that we pooled and just look at kids. So we have models that are just outcomes. It's obesity, it's physical activity of kids, it's diabetes in kids, as Dick presented, adult onset. Cardiovascular is not as relevant, but depression, air pollution exposure, asthma, all these outcomes are just on youth. But I think your question spoke to family structure as well. And there's social dimensions in there that some of the data set, either if you can measure it, some people have measured it. I'm interested we could talk more.
All right. Yes, you could just stay in.
Yeah.
Question.
Jonathan Netler with the Urban Land Institute here in Los Angeles. Just want to start quickly with a thank you to Dr. Jackson for all the work that he's done in bringing ULI, AIA, APA to the table. We've had an incredible penetration in all of our professional spheres, thanks to your work. But if quickly you could identify 2 or 3 of the primary challenges or obstacles that you see in actually effectuating change in the built environment, whether they be on the policy side, whether they're within the professional sphere, we need to become more educated with our colleagues. Is it in the private market side, embracing the value of health and wellness? Easy question, right?
Easy question.
There's 3 of us here, so I'm going to take one, which is the efforts, for example, by the Federal Reserve to really think about the mortgaging and the loan processes and how they could develop and encourage communities that work better for people and to how to add that metric, because ultimately it is about who gets the money to build what, and the right mortgage company can get the right thing or they can get something that doesn't work. I don't know if anybody else wants to add some other. Anything beyond money?
Well, cultural inertia. I mean, one of the things that I've seen a lot in Seattle is that as we try to densify the city, the low-density neighborhoods, which are full of people who voted for Clinton and are socially progressive, begin squawking. We don't want density. So I think there's some cultural inertia too. And the solution to that is telling the story better. That life can be really good in dense neighborhoods if they're built well.
People don't want crappy density.
Yeah. Good density is good, and you have to show that.
So
That's a technical term.
So there's a term called location efficiency, which you may know of. Housing and transportation are inverse. So basically, the point, and Center for Neighborhood Technology has worked on this a lot, but basically mortgage lending, and Dick touches upon it, but basically if you spend less on transportation, you can afford to spend more on housing. That should be wired into mortgage lending anyways, because risk is less where people spend less on transportation, meaning in a walkable neighborhood. Just letting people borrow more to live in a walkable neighborhood is not going to solve the problem. So what we need to layer on that is obviously building in the other benefits. You should get a lower interest rate. There should be, financial incentives. Where developers locate should be, if you want to go outside the growth boundary or urban service area, pay your way. So the regulatory, we know these things, but getting them into practice, what's the resistance is obviously being able to show the economic benefit to a broader set of society.
Another quick question. We've seen a growth in GIS technologies and mapping. It has grown a lot. You're now able to map down to the block group and present this data in really compelling ways. My question for you, is there any concern with this growth that we're now engaging in quasi-redlining? We could talk about it over lunch. In the red, yes.
Do climate restoration. So, huge kelp farms in the ocean or pumping ice water on top of the Arctic caps. Do you think we should jump into this, or should we be cautious and be concerned about the consequences, or wait? And how long do we wait before maybe we try something like that?
Well, I'll tackle that, Deborah. What I know about this comes from climate scientists I talk with, and I think the sense is number 1, 2, and 3 priorities have to be reducing greenhouse gas emissions and capturing carbon through afforestation and so on. We know what to do. We lack the political will, but we need to do those things. And we need to do it urgently. That said, we should not foreclose discussion of large-scale, sometimes outlandish-sounding plans, geoengineering and so on, because we may be losing the race. We may need to do drastic things, but it's extraordinarily difficult to predict the consequences of large-scale interventions, and one wants to be extremely cautious about going there.
All right. One last question. I've told in time. Dr. Judge, you can have whatever you want, so what do you want to keep going?
All I could think of, Deb, is I was working in India on smallpox eradication, and the World Bank was all over drilling tube wells, because this was going to fix the problem of diarrheal disease. And 30 years later, we're trying to fix the problems of people having terrible arsenic poisoning from the tube wells. So whatever you do to big populations, be very, very careful.
Please join me in giving these guys a hand. Great job.
Hey.
Unfortunately, we have to come to an end.